Medical Assistant Exam Clinical Skills Practice Test. Question 1. After reviewing the situation in an administrative check-in area, a pain score is being collected during intake. Which approach is best? Option A. Tell the patient pain is not part of vital signs. Option B. Assume pain level from facial expression only. Option C. Ask the patient to rate pain using the office's standard scale. Option D. Change the score to match the assistant's opinion. The correct answer is option C. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Pain assessment is commonly included in intake workflows. Facial expression alone may not reflect the patient's reported pain. The pain score should reflect the patient's report. Question 2. When a patient encounter unfolds in a quality control review, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Slow heart rate. Option B. Inflammation of the liver. Option C. High blood sugar. Option D. Fast breathing. The correct answer is option A. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. High blood sugar is hyperglycemia. Fast breathing is tachypnea rather than bradycardia. Question 3. In an exam room, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A. Ventricular filling with blood only. Option B. Atrial repolarization only as the visible main event. Option C. Ventricular depolarization. Option D. A lung gas exchange. The correct answer is option C. Ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Mechanical filling is not the primary electrical event represented by QRS. Atrial repolarization is usually hidden within the QRS complex. Gas exchange occurs in the alveoli, not on the QRS waveform. Question 4. The care team in a patient intake station asks for guidance because a patient asks why a medication is placed under the tongue. Which route is being described? Option A. Ophthalmic. Option B. Otic. Option C. Topical. Option D. Sublingual. The correct answer is option D. Sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Ophthalmic medications are used in the eye. Otic medications are placed in the ear. Topical medications are applied to the skin or surface tissues. Question 5. In an outpatient laboratory, a provider orders a capillary blood glucose test. Which site preparation is important? Option A. Puncture through visible dirt. Option B. Use the first visibly dirty drop for every test. Option C. Clean and dry the puncture site according to protocol. Option D. Skip patient identification because the test is quick. The correct answer is option C. Clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Contamination can affect the sample and infection risk. Site contaminants can affect the first drop depending on protocol. Patient identification is required even for quick point-of-care tests. Question 6. The care team in a pediatric clinic asks for guidance because an insurance plan requires approval before a specialist visit. Which process is being described? Option A. Auscultation. Option B. Prior authorization or referral process. Option C. Autoclaving. Option D. Venipuncture. The correct answer is option B. Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Auscultation is listening to body sounds and does not approve visits. Autoclaving sterilizes instruments and is unrelated to payer approval. Venipuncture is blood collection and does not authorize insurance coverage. Question 7. The care team in a medication administration visit asks for guidance because a pelvic examination is scheduled. Which patient position is commonly used? Option A. Lithotomy. Option B. Sims. Option C. Trendelenburg. Option D. A prone. The correct answer is option A. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position. Question 8. Before the visit continues in an electronic health record review, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A, tell the patient to drive home and rest. Option B, ignore the symptoms if the injection site looks clean. Option C, notify the provider and activate emergency protocol immediately. Option D, schedule a routine follow-up for next week. The correct answer is option C. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Respiratory symptoms and swelling require immediate attention. Systemic allergic symptoms matter even if the injection site appears normal. Potential anaphylaxis cannot be delayed for routine follow-up. Question 9. At the start of care in a family practice clinic, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A, bladder. Option B, spleen. Option C, pancreas. Option D, gallbladder. The correct answer is option D, gallbladder. The gallbladder stores and concentrates bile made by the liver. The urinary bladder stores urine, not bile. The spleen is involved in immune and blood cell functions. The pancreas produces digestive enzymes and hormones but does not store bile. Question 10. When a patient encounter unfolds in a patient intake station, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, leave the patient alone until they stop coughing. Option B, give the patient food to push it down. Option C, encourage coughing and monitor closely. Option D, perform blind finger sweeps immediately. The correct answer is option C, encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Blind finger sweeps can push the object deeper and are not appropriate. Question 11. An office review in a community health clinic shows that a patient needs crutch walking education after provider instruction. Which principle is important? Option A, body weight should rest mainly on the armpits. Option B, the patient should skip follow-up if pain increases. Option C, crutches should be used only on wet floors. Option D, crutches should fit properly and not press into the axilla. The correct answer is option D, crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Weight should be supported through the hands, not the axilla. Worsening symptoms should be reported according to instructions. Crutches are mobility aids and wet floors increase fall risk. Question 12. The care team in a family practice clinic asks for guidance because a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A, skip controls because waived means unregulated. Option B, use expired kits if the package is unopened. Option C, follow manufacturer instructions and quality control policy. Option D, report results before the test develops. The correct answer is option C, follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Expired test kits may give unreliable results. Reading before the correct time can produce inaccurate results. Question 13. After reviewing the situation in a same-day appointment, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A, follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option B, wear tight clothing that restricts breathing. Option C, eat a heavy meal immediately before every test. Option D, ignore all provider instructions about inhalers. The correct answer is option A, follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Restrictive clothing can interfere with respiratory effort. A heavy meal may interfere with comfortable breathing for some tests. Medication instructions should follow the provider or testing protocol. Question 14. To protect safety in a same-day appointment, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PASS. Option B, HIPAA. Option C, PERLA. Option D, ARICE. The correct answer is option A, PASS. PASS stands for pull, aim, squeeze, and sweep. HIPAA governs health information privacy and security. PERLA describes pupil assessment. RICE refers to rest, ice, compression, and elevation for certain injuries. Question 15. In a clinical skills review, a patient asks for printed medication instructions. Which practice improves health literacy? Option A. Provide instructions in the wrong language. Option B. Tell the patient to search online without guidance. Option C. Use clear language and review the key points with the patient. Option D. Use only complex medical terminology. The correct answer is option C. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Language mismatch can prevent safe understanding. Unguided online searching may provide inaccurate or confusing information. Complex terms can reduce comprehension. Question 16. For a patient encounter in a cardiology practice, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Patient confidentiality. Option B. Chain of custody. Option C. Prior authorization. Option D. Sterile technique. The correct answer is option A. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Chain of custody concerns specimen handling documentation, not public conversations. Prior authorization concerns payer approval for services. Sterile technique concerns preventing contamination during procedures. Question 17. Before the visit continues in a community health clinic, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A. Verify the allergy information and enter it clearly in the medical record. Option B. Place the form in the chart without reviewing it. Option C. Ask the patient to remember only prescription allergies. Option D. Remove allergies that the patient says happened many years ago. The correct answer is option A. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Allergies to over-the-counter drugs, foods, or latex may also affect care. Past reactions may still be clinically important and should not be deleted without provider direction. Question 18. To protect safety in a telephone triage workflow, the term gastroenterology appears in a referral. Which specialty is involved? Option A. Urinary bladder only. Option B. Nervous system. Option C. Endocrine glands. Option D. Digestive system. The correct answer is option D. Digestive system. Gastroenterology focuses on the digestive tract and related disorders. Urology focuses on the urinary tract and male reproductive system. Neurology focuses on the nervous system. Endocrinology focuses on hormone-producing glands. Question 19. As part of exam preparation in a primary care office, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Reprocess the instruments before use. Option B. Use the instruments if the package is dry. Option C. Write a new date on the package. Option D. Open the package and rinse the instruments. The correct answer is option A. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Changing the date without reprocessing is unsafe and misleading. Rinsing does not restore sterility. Question 20. For a patient encounter in a busy front office, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A. Another patient's insurance card. Option B. Only the patient's favorite pharmacy color. Option C. The assistant's diagnosis before the visit. Option D. Demographics, contact information, insurance information, and reason for visit. The correct answer is option D. Demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. Insurance information must belong to the patient being registered. That information does not complete registration. The assistant should not diagnose during scheduling. Question 21. For a patient encounter in a phlebotomy station, a chain of custody urine drug screen is collected. Which practice is most important? Option A. Allow the patient to take the specimen home first. Option B. Use an unlabeled container until the lab receives it. Option C. Document each transfer and maintain specimen integrity. Option D. Skip signatures if the specimen looks normal. The correct answer is option C. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Uncontrolled possession breaks specimen integrity. Unlabeled specimens can be rejected and cannot be reliably traced. Appearance does not replace custody documentation. Question 22. For a patient encounter in a certification exam scenario, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The oral temperature will decrease. Option B. The pulse oximeter will stop working. Option C. The reading may be inaccurate. Option D. The patient will automatically faint. The correct answer is option C. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Cuff placement does not change oral temperature. Blood pressure cuff alignment does not control the pulse oximeter. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Question 23. For a patient encounter in a women's health clinic, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Touch the vein again with an ungloved finger. Option B. Draw blood while alcohol is still wet. Option C. Allow the alcohol to dry completely. Option D. Blow on the site to speed drying. The correct answer is option C. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Palpating after cleaning can contaminate the site unless proper technique is used. Wet alcohol can sting and may affect specimen quality. Blowing can contaminate the cleansed site. Question 24. Following office protocol in an exam room, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Skip precautions if the patient is already taking medication. Option B. Place the patient beside an immunocompromised patient. Option C. Use only sterile gloves without a mask. Option D. Apply droplet precautions and offer a mask according to protocol. The correct answer is option D. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Treatment does not remove the need for appropriate precautions. Separating symptomatic patients helps reduce transmission risk. Sterile gloves do not protect mucous membranes from respiratory droplets. Question 25. Following office protocol in a women's health clinic, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The blood pressure may read falsely high. Option B. The pulse oximetry reading will be inaccurate. Option C. The blood pressure may read falsely low. Option D. The temperature will be elevated. The correct answer is option A. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size does not directly determine oxygen saturation accuracy. A cuff that is too large is more likely to produce a falsely low reading. Cuff size has no direct effect on body temperature. Question 26. Following office protocol in a primary care office, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A. Wipe the surface dry immediately. Option B. Dilute the solution more to reduce odor. Option C. Keep the surface wet for the full listed contact time. Option D. Use the disinfectant only on clean hands. The correct answer is option C. Keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Unapproved dilution can reduce disinfectant strength. Environmental disinfectants are not hand hygiene products. Question 27. During a patient education session, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A. Blood pressure and temperature. Option B. Pulse and respirations. Option C, oxygen saturation and pain score. Option D, height and weight. The correct answer is option D, height and weight. Body mass index is calculated from height and weight. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Oxygen saturation and pain score provide different clinical information. Question 28. During a certification exam scenario, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The test records electrical activity and does not deliver a shock. Option B. The machine draws blood through the wires. Option C. The electrodes inject medication. Option D. The test shocks every patient to start the heart. The correct answer is option A. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Question 29. A medical assistant is working in a pediatric clinic when a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. Ask other patients to help verify the record. Option B. State the full diagnosis loudly to confirm the visit. Option C. Speak quietly and avoid announcing sensitive details. Option D. Place all charts open on the counter. The correct answer is option C. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Other patients should not be involved in private verification. Announcing diagnoses in public can violate confidentiality. Open charts may expose protected information. Question 30. When a patient encounter unfolds in an electronic health record review, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A. As needed. Option B. Every morning. Option C. By mouth. Option D. Immediately. The correct answer is option A. As needed. PRN means the medication is taken as needed according to the order. Every morning is commonly abbreviated differently and is not PRN. By mouth is PA. Immediately is STAT in common medical usage. Question 31. The care team in a medical office workflow asks for guidance because an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Erase the value because it may worry the patient. Option B. Recheck using proper technique and report the finding according to protocol. Option C. Tell the patient that hypertension has been diagnosed. Option D. Send the patient home to rest without notifying anyone. The correct answer is option B. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Abnormal readings require appropriate follow-up rather than dismissal. Question 32. At the start of care in an infection control audit, a prothrombin time test is ordered. Which tube should be selected? Option A. Blood culture bottle only. Option B. Gray tube. Option C. Light blue tube. Option D. Lavender tube. The correct answer is option C. Light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Blood cultures detect microorganisms and are not used for prothrombin time testing. Gray fluoride oxalate is not the standard additive for coagulation studies. Lavender EDTA is used for hematology and can interfere with coagulation testing. Question 33. When a patient encounter unfolds in a procedure setup, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A. Prone position. Option B. Fowler position. Option C. Trendelenburg as the only routine choice. Option D. Lithotomy position. The correct answer is option B. Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Lithotomy is used for pelvic procedures and does not primarily support breathing. Question 34. When a patient encounter unfolds in a telephone triage workflow, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A. Patient seems dramatic about ear pain. Option B. Patient reports sharp right ear pain for 2 days. Option C. Right ear normal after exam. Option D. Ear infection diagnosed today. The correct answer is option B. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. Subjective judgment is unprofessional and not appropriate for the medical record. Exam findings belong to the provider and are not the chief complaint. A diagnosis should not be documented by the assistant unless the provider has made it. Question 35. For a patient encounter in a phlebotomy station, a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A. Ignore the symptoms because they are subjective. Option B. Give a diagnosis to save time. Option C. Document the symptoms and tell the patient the provider will evaluate them. Option D. Tell the patient to search the internet for a diagnosis. The correct answer is option C. Document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Reported symptoms are relevant and should be documented. Diagnosing is outside the medical assistant scope. Unguided self-diagnosis can be inaccurate and unsafe. Question 36. Following office protocol in a patient intake station, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A. Handle the dressing with bare hands. Option B. Use gloves and dispose of the dressing according to biohazard policy. Option C. Place the dressing on the clean supply tray. Option D. Save the dressing in the patient's purse. The correct answer is option B. Use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Bare hand contact increases exposure risk. Soiled material can contaminate clean supplies. Biohazard waste should not be sent home in personal belongings. Question 37. In a busy front office, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Below normal. Option B. Around. Option C. Between. Option D. Above normal or excessive. The correct answer is option D. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Below normal is indicated by hypo. Around is indicated by peri. Between is indicated by inter. Question 38. The care team in a cardiology practice asks for guidance because a patient falls in the exam room. Which action is best? Option A. Call for help and assess for injury before moving the patient. Option B. Tell the patient to drive home without evaluation. Option C. Hide the incident if no one saw it. Option D. Pull the patient up immediately. The correct answer is option A. Call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. The patient should be assessed before leaving. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. Question 39. At the start of care in a family practice clinic, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A. Open hours. Option B. Clustering. Option C. Wave scheduling. Option D. Double booking. The correct answer is option D. Double booking. Double booking places more than one patient in the same appointment slot. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Wave scheduling schedules several patients to arrive at the beginning of a block. Question 40. Given the workflow in a phlebotomy station, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Abandonment. Option B. Patient autonomy. Option C. Respondeat superior. Option D. Beneficence. The correct answer is option B. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Respondeat superior concerns employer responsibility for employee actions. Beneficence means acting for the patient's good but does not override a competent refusal. Question 41. Given the workflow in a quality control review, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A. Leave the old pharmacy because it is already in the chart. Option B. Delete all pharmacy information from the record. Option C. Update the preferred pharmacy after verifying the new information. Option D. Choose the pharmacy closest to the clinic. The correct answer is option C. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows. The preferred pharmacy should come from the patient rather than staff convenience. Question 42. A medical assistant is working in a treatment room when a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A. Tell the patient fasting means no restrictions at all. Option B. Review fasting instructions and route medication questions to the provider. Option C. Cancel the test because diabetes always prevents fasting labs. Option D. Tell the patient to stop all diabetes medications without provider input. The correct answer is option B. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Fasting usually includes specific limits on food and drink. Diabetes requires careful instructions but does not automatically cancel testing. Medication changes can be unsafe without provider direction. Question 43. When a patient encounter unfolds in a women's health clinic, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Guess the opening date from memory. Option B. Follow facility policy and do not use it if safety cannot be verified. Option C. Mix it with another vial to avoid waste. Option D. Use it because the cap is still attached. The correct answer is option B. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. The cap does not prove when the vial was opened or whether it was stored correctly. Question 44. To protect safety in a same-day appointment, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A. Skip explanations because the patient signed in. Option B. Provide appropriate draping and expose only the area being examined. Option C. Leave the patient uncovered until the provider arrives. Option D. Discuss the patient's body in the hallway. The correct answer is option B. Provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Patients still need respectful communication during preparation. Unnecessary exposure reduces dignity and comfort. Public discussion can violate privacy and professionalism. Question 45. As part of exam preparation in a patient education session, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Place a warning sign and arrange cleanup immediately. Option B. Wait until a patient reports slipping. Option C. Ignore it because it is not in an exam room. Option D. Cover it with loose papers. The correct answer is option A. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Prevention should occur before an injury happens. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Question 46. After reviewing the situation in a clinical skills review, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A. Offer water by mouth immediately. Option B. Finish documenting the previous visit. Option C. Activate emergency response and assess breathing according to training. Option D. Move the patient to a chair before assessing. The correct answer is option C. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Question 47. To protect safety in a phlebotomy station, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Leave the wheelchair unlocked for easier movement. Option B. Pull the patient by the arms quickly. Option C. Ask the patient to jump to the table. Option D. Lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Jumping is unsafe and unrealistic for a transfer. Question 48. For a patient encounter in an outpatient laboratory, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A. Ophthalmoscope only. Option B. Suture removal scissors or sterile scissors according to policy. Option C. Tuning fork only. Option D. Peak flow meter only. The correct answer is option B. Suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. An ophthalmoscope is used to examine the eye, not remove sutures. A tuning fork may be used in hearing or vibration tests. A peak flow meter measures expiratory airflow and does not remove sutures. Question 49. During a medication administration visit, an intradermal test is being prepared. Which description matches the route? Option A. Medication swallowed by mouth. Option B. Injection into deep muscle tissue. Option C. Injection just under the epidermis to form a small wheal. Option D. Medication placed into the ear canal. The correct answer is option C. Injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Swallowed medication is oral administration. Deep muscle injection is intramuscular. Ear canal administration is otic. Question 50. While working in a specialty referral visit, a peak flow test is ordered. Which body system is being assessed? Option A. Skeletal system only. Option B. Urinary system. Option C. Respiratory system. Option D. Integumentary system. The correct answer is option C. Respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. Peak flow does not measure bone structure. The urinary system is assessed with urine tests and related procedures. The integumentary system involves the skin, hair, and nails. Question 51. Given the workflow in a certification exam scenario, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A. Tourniquet. Option B. Snellen chart. Option C. Autoclave tape. Option D. Hemostat. The correct answer is option B. Snellen chart. A Snellen chart is used to screen distance visual acuity. A tourniquet helps locate veins for blood collection. Autoclave tape indicates exposure to sterilization conditions. A hemostat clamps tissue or small objects during procedures. Question 52. For a patient encounter in a medication administration visit, a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A. 0.5 milliliter. Option B. 5 milliliters. Option C. 10 milliliters. Option D. 1 milliliter. The correct answer is option A. 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 5 milliliters would provide 500 milligrams at this concentration. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 1 milliliter would provide 100 milligrams. Question 53. When a patient encounter unfolds in an electronic health record review, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A. Use the parent's estimate if the scale is nearby. Option B. Record the measurements using the unit required by the office protocol. Option C. Round weight to the nearest 10 pounds. Option D. Record height only because weight changes often. The correct answer is option B. Record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Both height and weight may be needed for clinical assessment. Question 54. For a patient encounter in an urgent care office, a mask becomes wet during patient care. Which action is appropriate? Option A, share it with a coworker. Option B, replace the mask according to infection control practice. Option C, dry it on the clean supply shelf. Option D, keep wearing it for the rest of the week. The correct answer is option B. Replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Masks are not shared between staff. Used masks can contaminate clean areas. Extended use of a wet mask is not appropriate. Question 55. An office review in a cardiology practice shows that a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A, lie flat immediately without assessment. Option B, sit upright and lean slightly forward. Option C, pack the nose with contaminated gauze. Option D, tilt the head far backward. The correct answer is option B. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood, while upright posture can reduce pressure. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Contaminated materials should not be inserted into the nose. Tilting backward can cause blood to drain into the throat. Question 56. At the start of care in a preventive care visit, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A, remove electrodes whenever symptoms occur. Option B, keep a diary of symptoms and activities as instructed. Option C, ignore the return time. Option D, submerge the monitor in water. The correct answer is option B. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Removing electrodes can interrupt recording when data are most important. The monitor must be returned as scheduled for data review. Water can damage the device and create safety risks. Question 57. Before the visit continues in a specialty referral visit, a sterile package is torn before a minor procedure. Which action is required? Option A, use the items if they look clean. Option B, consider the contents contaminated and obtain a new sterile package. Option C, spray the package with disinfectant. Option D, tape the wrapper and use the contents. The correct answer is option B. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Clean appearance does not prove sterility. Surface disinfectant cannot sterilize items inside a compromised package. Taping does not restore sterility after the barrier is compromised. Question 58. Following office protocol in an internal medicine office, a patient makes a complaint about care received in the office. Which response is most professional? Option A, delete documentation related to the complaint. Option B, post the complaint online for staff opinions. Option C, listen respectfully and follow the office complaint process. Option D, argue until the patient stops complaining. The correct answer is option C. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Destroying or altering records is unethical and may be illegal. Publicly sharing patient concerns can violate confidentiality. Arguing escalates conflict and is unprofessional. Question 59. After reviewing the situation in an outpatient laboratory, the term tachypnea appears on an intake form. Which meaning is correct? Option A, low temperature. Option B, painful urination. Option C, rapid breathing. Option D, slow pulse. The correct answer is option C, rapid breathing. Tachy means fast, and nea relates to breathing. Low temperature is hypothermia. Painful urination is dysuria. Slow pulse is bradycardia. Question 60. After reviewing the situation in an exam room, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, skip technique instructions because home cuffs are automatic. Option B, write only the highest number ever measured. Option C, record readings with date, time, and relevant notes as directed. Option D. Use another person's readings if the cuff is shared. The correct answer is option C. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Proper positioning and technique still matter with automatic cuffs. Selective recording can mislead clinical decisions. Readings must belong to the patient. Question 61. After reviewing the situation in a family practice clinic, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, otoscope. Option B, reflex hammer. Option C, centrifuge. Option D, ophthalmoscope. The correct answer is option D, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. An otoscope is used for the ear canal and tympanic membrane. A reflex hammer tests reflexes and does not visualize the retina. A centrifuge separates specimen components and is not an eye exam tool. Question 62. In a procedure setup, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A, diagnose the patient based on abnormal values. Option B, tell the patient the provider will review and explain the results. Option C, change the results so it appears normal. Option D, post the result publicly so others can comment. The correct answer is option B. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Diagnosis is outside the medical assistant scope of practice. Changing results is unethical and falsifies the record. Public disclosure violates confidentiality and professionalism. Question 63. At the start of care in a medical office workflow, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, create new instructions that contradict the provider. Option B, avoid documenting that instructions were given. Option C, review the provider-approved instructions and confirm understanding. Option D, tell the patient not to call if symptoms worsen. The correct answer is option C, review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Instructions should match the provider's plan and office protocol. Patient education should be documented according to policy. Patients should know when and how to seek help for concerning symptoms. Question 64. After reviewing the situation in a specialty referral visit, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A, discard the tracing to avoid alarming the patient. Option B, diagnose the rhythm for the patient. Option C, give the tracing to the provider promptly according to protocol. Option D, change the tracing to make it look normal. The correct answer is option C, give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Abnormal results must not be hidden or discarded. Medical assistants should not provide a cardiac diagnosis. Altering medical records is unethical and unsafe. Question 65. When a patient encounter unfolds in a community health clinic, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A, abandonment. Option B, coinsurance. Option C, beneficence. Option D, assault. The correct answer is option A, abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Coinsurance is a payment-sharing insurance term. Beneficence means acting for the patient's good. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Question 66. The care team in an electronic health record review asks for guidance because the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A, sugar in the blood. Option B, blood in the urine. Option C, protein in the stool. Option D, air in the lungs. The correct answer is option B, blood in the urine. Hematuria means blood is present in the urine. Sugar in the blood is described by glycemia terms. Protein in stool is not hematuria. Air in the lungs is not described by hematuria. Question 67. When a patient encounter unfolds in a cardiology practice, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A, use the same gloves to clean the next room. Option B, perform hand hygiene. Option C, place the gloves in a regular drawer. Option D, apply lotion instead of cleaning hands. The correct answer is option B, perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Gloves are task-specific and should not be reused between patients or areas. Used gloves are contaminated waste and should be discarded properly. Lotion does not replace hand hygiene. Question 68. As part of exam preparation in an infection control audit, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, record the first seated blood pressure as orthostatic. Option B, have the patient walk quickly before the measurement. Option C, measure blood pressure and pulse in different positions according to protocol. Option D, measure only oxygen saturation while the patient is seated. The correct answer is option C, measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. A single seated reading does not show positional change. Exertion can distort the readings and increase fall risk. Oxygen saturation does not assess the blood pressure and pulse changes requested. Question 69. Before the visit continues in an electronic health record review, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A, continue if the last name matches. Option B, correct the date of birth without asking anyone. Option C, use the appointment time as the identifier. Option D is stop and resolve the discrepancy before proceeding with care. The correct answer is option D, stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. A last name alone does not rule out an identity error. Changing demographic data without verification may create a documentation error. Appointment times are scheduling data and are not approved identifiers. Question 70. Following office protocol in a phlebotomy station, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, begin CPR and use the automated external defibrillator as directed. Option B, use the defibrillator on a conscious patient asking questions. Option C, wait for the provider before starting any response. Option D, give oral medication before checking responsiveness. The correct answer is option A, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. Question 71. Before the visit continues in a certification exam scenario, a specimen must be protected from light after collection. Which handling method is appropriate? Option A, shake the specimen vigorously for 1 minute. Option B, wrap the specimen in foil or use an amber container as directed. Option C, leave the specimen uncovered at the front desk. Option D, place the tube in direct sunlight to warm it. The correct answer is option B, wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Sunlight can degrade light-sensitive specimens. Question 72. As part of exam preparation in a patient intake station, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, change the medication to another drug independently. Option B, hold the medication and notify the provider. Option C, ask the patient to sign a form and give it anyway. Option D, administer the medication because it was ordered. The correct answer is option B, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. Medical assistants do not independently substitute medications. A form does not make an unsafe medication appropriate. An order does not override a possible allergy. Question 73. When a patient encounter unfolds in an infection control audit, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, Insurance Remittance Advice. Option B, Appointment Reminder Template. Option C, Safety Data Sheet. Option D, Patient Intake Form. The correct answer is option C, Safety Data Sheet. The Safety Data Sheet gives hazard, handling, storage, and spill response information for chemicals. Remittance Advice explains payment decisions, not chemical hazards. Reminder templates do not address workplace chemical safety. An intake form does not provide chemical safety instructions. Question 74. When a patient encounter unfolds in a phlebotomy station, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A, use it after expiration if it looks clear. Option B, maintain required temperature storage and check expiration before use. Option C, place it in direct sunlight to warm quickly. Option D, store it in a desk drawer overnight. The correct answer is option B. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Sunlight and heat can damage the product. Room temperature storage can damage refrigerated products. Question 75. To protect safety in a primary care office, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A, ask another patient what the abbreviation means. Option B, clarify the order before proceeding. Option C, ignore the medication order completely without communication. Option D, interpret the abbreviation however it seems most likely. The correct answer is option B, clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. Patients are not appropriate sources for interpreting orders. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Question 76. An office review in a medication administration visit shows that a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, adjustment. Option B, deductible. Option C, premium. Option D, copayment. The correct answer is option D, copayment. A copayment is a fixed amount the patient pays for a covered service. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. A premium is the amount paid to maintain insurance coverage. Question 77. As part of exam preparation in a treatment room, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, ureter. Option B, axon. Option C, platelet. Option D, alveolus. The correct answer is option B, axon. An axon carries nerve impulses away from the neuron cell body. A ureter carries urine from kidney to bladder. A platelet is a blood component involved in clotting. An alveolus is a lung air sac. Question 78. At the start of care in a cardiology practice, a patient requests an appointment reminder by text message. Which consideration is important? Option A, follow office policy and patient communication preferences. Option B, post the reminder on social media. Option C, text any diagnosis to any phone number in the chart. Option D, ignore all reminder preferences. The correct answer is option A, follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Public posting would expose private information. Sensitive information and wrong numbers can create privacy risk. Preferences help guide appropriate communication. Question 79. For a patient encounter in a women's health clinic, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A, leave the patient standing while searching for forms. Option B, tell the patient dizziness is impossible. Option C, ask the patient to walk faster. Option D, assist the patient to sit or lie down safely. The correct answer is option D, assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. An unsteady patient should not be left unsupported. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. Question 80. In a specialty referral visit, office supplies are consistently running out before the next order date. Which administrative action is best? Option A. Track usage and adjust PAR levels according to office needs. Option B. Hide supplies from the provider. Option C. Wait until every item is completely gone. Option D. Order random supplies without reviewing use. The correct answer is option A. Track usage and adjust PAR levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Hiding supplies does not solve inventory management. Waiting can interrupt patient care and office workflow. Unplanned ordering can waste money and storage space. Question 81. To protect safety in a cardiology practice, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A. Assume the patient cannot participate. Option B. Shout from another room. Option C. Cover the mouth while speaking. Option D. Face the patient and speak clearly at a moderate pace. The correct answer is option D. Face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Hearing difficulty does not mean the patient cannot understand or decide. Shouting from a distance reduces clarity and privacy. Covering the mouth removes visual cues. Question 82. In a busy front office, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A. Use tape only and skip electrodes. Option B. Clean and dry the skin before applying electrodes. Option C. Apply electrodes directly over lotion. Option D. Move all chest leads to the abdomen. The correct answer is option B. Clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Tape cannot record cardiac electrical activity. Poor adhesion can cause artifact or lead loss. Incorrect lead placement changes the tracing and may impair interpretation. Question 83. The care team in an infection control audit asks for guidance because the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Record the respiratory rate from the last visit. Option B. Count for 5 seconds and multiply by 12. Option C. Count respirations while the patient is unaware of the measurement. Option D. Ask the patient to breathe as deeply as possible. The correct answer is option C. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Current respirations must be measured during the encounter. Very short counts are often inaccurate for respirations. Deep breathing changes the normal respiratory rate and effort. Question 84. For a patient encounter in a specialty referral visit, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A. Change only the paper on the exam table. Option B. Open the door to air out the room only. Option C. Clean and disinfect touched surfaces according to office protocol. Option D. Spray disinfectant and wipe it off immediately every time. The correct answer is option C. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. The exam table paper does not address other touched surfaces. Ventilation alone does not remove organisms from contaminated surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Question 85. Before the visit continues in a family practice clinic, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A. Speak louder and slower in English only. Option B. Ask a young child to interpret. Option C. Skip the explanation if the patient nods. Option D. Use a qualified medical interpreter. The correct answer is option D. Use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Volume does not remove a language barrier. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Nodding does not prove understanding or valid communication. Question 86. A medical assistant is working in a medication administration visit when a staff member shares an electronic health record password to save time. Which risk is created? Option A, improved privacy protection. Option B, automatic insurance approval. Option C, better sterilization monitoring. Option D, loss of accountability for chart access. The correct answer is option D, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Password sharing weakens privacy and security. Passwords do not control payer authorization. Login credentials do not sterilize instruments. Question 87. Before the visit continues in a clinical skills review, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, ignore the anxiety to avoid making it worse. Option B, promise that the provider will not be concerned. Option C, tell the patient the reading is probably wrong. Option D, acknowledge the concern and explain the procedure in simple terms. The correct answer is option D, acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Ignoring patient concerns can increase anxiety and weaken communication. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Question 88. An office review in a phlebotomy station shows that the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, urinary bladder. Option B, appendix. Option C, thyroid gland. Option D, gallbladder. The correct answer is option C, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. Question 89. A medical assistant is working in a patient intake station when the abbreviation NPO appears before a procedure. Which instruction does it represent? Option A, new patient only. Option B, nothing by mouth. Option C, normal pulse output. Option D, nasal passage open. The correct answer is option B, nothing by mouth. NPO means the patient should take nothing by mouth for the specified period. New patient only is not the meaning of NPO. NPO does not describe pulse measurement. NPO is not a nasal assessment abbreviation. Question 90. For a patient encounter in a cardiology practice, a used needle must be discarded after an injection. Which practice is safest? Option A, activate the safety device and place the needle in a sharps container. Option B, carry the needle to the front desk for disposal. Option C, place the needle in regular trash. Option D, recap the needle with both hands. The correct answer is option A, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Sharps can injure staff and must not go into regular trash. Two-handed recapping increases needle stick risk. Question 91. After reviewing the situation in a clinical skills review, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A, speculum for pelvic exam. Option B, spirometer. Option C, ophthalmoscope. Option D, otoscope. The correct answer is option D, otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A vaginal speculum is not used to inspect the ear canal. A spirometer evaluates lung function rather than the ear. An ophthalmoscope is used to examine internal eye structures. Question 92. At the start of care in a patient intake station, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, open sterile supplies without touching the inner sterile surface. Option B, place sterile gauze on an unclean counter. Option C, reuse sterile gloves from a previous patient. Option D, reach across the field with unsterile clothing. The correct answer is option A, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Reaching over the field can contaminate it. Question 93. For a patient encounter in a treatment room, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, supine. Option B, Fowler. Option C, Sims. Option D, prone. The correct answer is option A, supine. Supine means lying on the back facing upward. Fowler position is seated or semi-seated. Sims position is side-lying with one knee flexed. Prone means lying face down. Question 94. To protect safety in a treatment room, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A, remove the band so it does not worry the patient. Option B, ignore the band if the patient seems healthy. Option C, verify the allergy information in the record and with the patient. Option D, give medication first and ask about allergies later. The correct answer is option C, verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergy risk is not based on appearance. Allergies must be checked before administration. Question 95. Following office protocol in a phlebotomy station, a provider orders spirometry in the office. Which patient action is required? Option A, hold both nostrils and refuse to exhale. Option B, remove the mouthpiece before starting. Option C, follow instructions for a strong, complete breathing maneuver. Option D, talk continuously during the maneuver. The correct answer is option C, follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The test depends on controlled breathing through the device. The mouthpiece is needed to measure airflow. Talking interferes with airflow measurement. Question 96. Before the visit continues in a same-day appointment, an electronic record uses an audit trail. What is its purpose? Option A, sterilize instruments automatically. Option B, measure blood pressure. Option C, approve insurance claims instantly. Option D, track who accessed or changed information. The correct answer is option D, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Audit trails do not process instruments. Vital sign measurement requires clinical equipment and technique. Payer claims processing is separate from record audit logs. Question 97. In a patient intake station, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A, finish all remaining patients before telling anyone. Option B, wash the area and report the exposure according to protocol. Option C, place a bandage on the site and ignore it. Option D, hide the incident if there is no bleeding. The correct answer is option B, wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Delaying reporting can delay needed evaluation and follow-up. Covering the wound alone does not address exposure risk. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Question 98. An office review in a patient intake station shows that a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, a normal calibration mark only. Option B, a properly grounded machine with still patient. Option C, poor electrode contact or patient movement. Option D, correct limb lead placement. The correct answer is option C, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Correct placement should reduce rather than create artifact. Question 99. In an internal medicine office, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, place the probe over wet nail polish. Option B, increase oxygen without reporting the finding. Option C, warm the finger or choose a better perfused site. Option D, ignore the waveform and record the lowest value. The correct answer is option C, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Moisture and polish can interfere with sensor performance. Medication or oxygen changes should follow provider direction and clinical protocol. An unstable signal should be corrected before documenting the value. Question 100. Given the workflow in a women's health clinic, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A, disinfection always destroys every spore. Option B, packaging instruments makes cleaning unnecessary. Option C, organic material can interfere with sterilization. Option D, sterilization is the same as hand washing. The correct answer is option C. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Disinfection reduces many organisms but does not reliably destroy all spores. Packaging dirty instruments traps contamination rather than preparing them safely. Hand washing reduces microbes on skin but is not instrument sterilization.